Love you too. I think I'm mic'd, so can you hear me okay? Yes? Yes? In the back too, you can hear me? Okay, I'd rather not stand at the podium if that's okay, although I do need my clicker. I never get used to hearing myself introduced. I'm my mother's child. I grew up in North Philadelphia from very limited circumstances, and one of my regrets is that my mother... okay, then I'll stand at the microphone. Sorry. I said I never get used to hearing myself introduced by others, and I often don't recognize who they're talking about. And I can just imagine my mother, Hattie Kane, who just passed 2 years ago, turn to me and say, "Who are they talking about?" So thank you, Paula, for your kind words. I'm delighted to be here. It's my first time in Kalamazoo, Michigan. And I appreciate that the weather is so warm because I left my coat. It wasn't until I was on the plane that I realized it's like, I am flying to Kalamazoo, Michigan without a coat. But it's fine. I haven't been cold since I've been here, so I appreciate that. I'm here to talk about an aspect of diversity, and I know that this lecture kicks off a diversity conference that starts tomorrow. We had a lovely lunch with some of the organizers, and we talked a lot about the importance of diversity. I, of course, lead a multicultural department back at AARP. But at AARP, we talk about diversity in terms of race and ethnicity. We talk about diversity in terms of geography. Frankly, at AARP, because we're a nonpartisan organization, we talk about diversity in terms of political schools of thought. We're not a liberal organization. We're not a conservative organization. We hope that we're always talking to everybody. But of late, we've recognized that it's really important for us, in the context of diversity, to talk about aging. And our CEO, Joanne Jenkins, recently has launched an effort that we call Disrupt Aging. She's actually recently written a book, and Paula said we should have had copies here, and I regret that we don't. But it's all about how this country needs to start thinking about how we age. So first I want to ask, and maybe I can have a few brave souls just answer this question. What's the first thing you think about when someone says aging? Someone just shout out a few words. Old. Illnesses. That's very telling. AARP. That's a good answer. Retired. Freedom. Okay, freedom. Freedom. All of those are right depending on who you are and what you think about growing older. We asked, and I have to do this over here, we asked some younger folks, and I wanted to just show quickly this video. Hopefully it'll work.
Hey, how's it going? You can stand right there, that's your mark. How you doing?
I'm great, how are you?
Great. Just tell us your first name and your age.
My real age?
My name is Paolo. I'm 25 years old.
My name is Daniela, and I'm 19.
24. 35.
31. 33.
I'm 26 years old.
What age do you consider to be old?
Late 40s?
I feel like 30s and new 20s, so I'd say like 40 is old.
I'd probably say 50s.
Oh, you're not.
I'd like you to show me how an old person would cross the street. How might an old person do a push-up? What about jumping jacks? Okay, hang on. There's someone I want you to meet.
Hello, I'm Birch. I'm 66.
I'm Daphne, and I'm 68.
Dee, and I'm 55.
George Fassbinder, 75.
My name is Parvati. I'm 70.
Nice to meet you.
Nice to meet you.
We're going to give you about 2 minutes to teach each other something that you are good at.
I can teach you the jump that I do.
Okay, please.
Both of your legs go up, and your arm goes up, and your left arm goes up. Ready?
Okay.
1, 2, 3, lift. 1, 2, and bring it to your heart, and bring it to your heart, and head in, yeah. And I try to get your balance, and knees up.
Yeah.
5, 6, 7. So when you come out of the turn, either way, you go back to that.
Can you help me get back to the screen?
Absolutely.
Yeah.
Square like this, and we up. Hook, jab, cross, hook, and then we'll go like this. Alright? 1, 2, 3.
Now, what age might you consider to be old?
Probably 80 or 90. He could just do everything that I told him to do. An age that I would consider to be old now might be 100.
You remember what you said?
Yeah, I said in the 50s. I thought very low. But when I thought about it,
Wait a minute.
I'm sorry.
I'm going to change my thinking of what old is.
You taught me something today.
Clearly, there's no way she's old, you know?
Now I know from today, hey, I don't look at age.
At my age, I feel like I did when I was in my 20s.
There's so many things that I still want to do. There's so many things that I can do. As long as I'm growing and learning, then age doesn't matter.
When people start stopping, that's when they start getting old.
Thank you. Thank you so much. Thanks, Daphne.
It's great meeting you.
How long have you been doing this? Is this a year?
40 years.
So you might not be able to say see what it said at the end, but we need to define, we need to define how we redefine how we define age. So now we'll go back to the presentation, and so, but can we?
So I always look at the camera. Okay, cool.
Hi.
Most millennials don't.
So I hope what that demonstrated is that, and it brought together millennials and older adults, but we find this even with people who are over the age of 50. How many of those of you in the room who are over the age of 50 have said, because I know I say it all the time, I'm having a senior moment. My aging eyes. We were talking at lunch. I hope I don't fall anytime soon because, for older people, that can be a really serious event. Age, and I will say ageism, permeates a lot of what we do and how we think. We often think about aging meaning that you're going to go gray. I am going gray. I just use dye, really well. And I will until I... And so my CEO would say that is an ageist kind of statement, that I just can't embrace my age. So no one will text her and let her know that I say that. I'm still struggling with that. Wrinkles, slowing down. That's generally what we think about when we have ageist notion. But you can go gray, you can have wrinkles, and you can slow down. But our thoughts and our beliefs is that doesn't mean that you're at the end of your life, that the way we're defining age, really almost 1 foot in the grave, is not how we should be thinking about aging anymore. And we should reject those ageist notions. This is a quote from Gwendolyn Brooks. How many know who Gwendolyn Brooks is? That's an age test. She's an African-American female poet who very renowned. As you get older, you find that often the wheat disentangles itself from the chaff, comes out to meet you. And what that means to me is that Chaff is sort of what surrounds the best part of the meat, of the wheat. And when you're able to disentangle yourself from that, you see the best of what that nutrient, that plant has to offer. So this is a favorite of mine. I just thought that I would add. What we hope to do at AARP, and what I want to talk to you a little bit more about in terms of discarding our aging notions, is that one, we have more older people. They're living longer. You have no idea, and I'll talk a little bit more about that. They're doing more, and for our capitalist society, they're spending more. How many parents are in the room? How many parents of, and I love millennials, I have 3 of my own. Great. How many of you are parents of millennials? How many of you are still covering cell phone bills for your millennial children? Not many. We have a lot of spending power, more power. Our advertising business used to be, and still is to a great degree, focused on 18 to 34-year-olds, because in the past, they had more spending power. Statistics show now that people over the age of 50 outspend and out-earn most of the other segments in the country. Every day, 10,000 people in the United States are turning the age of 65. By 2060, the number of folks who are over the age of 65 will more than double. And I know that seems like a long way away, but it's not. That's in the for many of us, that's in the foreseeable future. How many of you know a 10-year-old today? Think of the 10-year-old that you know. 50% of 10-year-olds living today will likely live to be 104. 50%. The person who is going to live to be 150, scientists believe, has already been born. 150. Does that suggest, does that explain why we need to stop defining old age as being 60 or 70? We can soon see in this country where it is the norm for people to live above the age of 100. Yet now, we still consider a 68 or 70-year-old to be old. 80% of boomers are likely to work past the age of 65. I work with a woman, I shouldn't be very specific. I almost made a mistake there. She wouldn't want me to necessarily share all of this, but I work with a lot of folks at AARP who are in their 70s. I work with one woman who's 79 years old. I have a good friend whose mother is 95 and still drives and parallel parks better than both of us. So again, we need to clearly change our views of aging. $7.6 trillion, that's the economic activity of people over the age of 50. And for every dollar that is spent in this country, 51 cents is spent by someone over the age of 50. Yet our advertising industry and the way we decide how most television shows and movies are really still dictated by the 18 to 34-year-old. And I want to add, I am in no way encouraging any kind of battle or competition between younger and older segments of our society. AARP is all about intergenerational living and embracing. More and more we have intergenerational households. We are looking at proposals that will have, as opposed to senior environments where as you age you live only with older adults, we think it would be a great idea as folks age, there are more mixed settings where older adults are living with younger people because there's lots of research that shows the benefits of that. The challenge, and so we call this disrupt aging, and stopping the ageist conversation that we often have in this, amongst ourselves and in this country. Because in fact, the way people are aging is changing. Now I want to pause here and say that yes, the way people are aging is changing. The person who's going to live to be 150 has already been born. Half of 10-year-olds will live to be over the age of 100. But for this, we are also talking about diversity, and I don't want to overlook the fact that there is still a lot of excess morbidity and mortality that comes as you age, particularly when you are of color. I mentioned, and it very much defines who I am, that I've been a caregiver for most of my adult life. First for my mother, who passed in the last 2 years, and then for a younger brother. And so I have regrettably been in and out of a lot of rehab facilities. I've spent a lot of time at hospital bedsides, in wards, in floors of rehab hospitals, and I am absolutely shocked and petrified by the number of people in their 60s who are confined to nursing homes and rehab facilities because of diabetes, because they've lost limbs, because of heart disease, because of cancers. The level of, so we are living longer, but don't mistake that statement to mean that we are living healthier, because unfortunately, not for all populations is that true. And so the challenge for us as we fight these notions of ageism is to live the dream that you can live longer, healthier, because really, if not, I don't want to live to be 110 if for 20 of those years I'm going to be sick. And for many people, particularly African Americans and Hispanic Latinos, that is their reality. That even if you look at the health disparity numbers, those groups that traditionally have suffered the worst are living longer. But this longer trajectory means that they're living longer, sicker. So we still have a lot to do and a lot to address when it comes to living healthily. But overall, people, the way we're aging is changing. People are living longer. They're trying to stay healthier. Certainly, they are taking care of children, friends, parents, communities. AARP has a major caregiving initiative. There are 42 million family caregivers in this country that are providing unpaid care. How many people are a caregiver for someone? Either a spouse, a mother, a child, a disabled child. This room is atypical. There are not a lot of hands up. We talk to a lot of folks who have that responsibility on top of working every day. Family caregivers provide an enormous amount of care that historically was provided by the healthcare system. That, you know, when my mother was alive, I changed catheters, I treated wounds, I had to assess symptoms, I had to give medication. A lot of tasks that traditionally went to the healthcare system has been pushed on to family caregivers. So older folks, you'd be surprised at how many people over the age of 65, 70, because people are living longer, have responsibility for caring not only for children, but for their parents and spouses as well. And yet, as I mentioned before, most of our beliefs about aging are outdated, and what we're trying to do at AARP is change the conversation, change the dialogue, change the understanding and definition about what it means to age. I want to show one more video. And I might need help changing this to its full screen.
Hi. Hey. Just one question really quick. You're not over 40, are you? Perfect. Great. Age limit? No. We are not serving anybody over 40 today. We're trying to have a little bit younger vibe today. You are exactly what we're looking at. If you're under 40, I'm actually not going to take your order, sir. Thank you so much for your interest, but we're just trying something different. You're just not exactly what we're looking for.
Every day, age discrimination happens in the workplace behind closed doors. And we wanted to see what it would look like out in the open. So we hid cameras in a food truck and refused to serve anyone over 40.
Are you under 40?
It's for my daughter, it's not for me.
Oh, it's for your daughter.
Yeah.
As long as you don't eat them. Okay. Okay. Usually people just step away from the food truck since you're not under 40. And I'll bring you the beignets. I don't want people to get the wrong impression if you're standing over here. You guys are under 40, right? Yeah. Okay, great. I can take your order. Yeah, absolutely.
I don't know what's happening.
This is a stupid thing that's starting to get really pissed off.
Yeah, so if it's us, if you have a specific problem with somebody, then say that specifically.
Okay, for real. Walking away, I was really upset. I almost started crying. I was updating my resume and I sort of wanted to sound experienced without sounding too old. I was like, oh, I'm experienced, but that's almost not an asset anymore. Because I have to sound young and relevant.
Older people just don't really fit into our culture. We actually don't think that this truck is a good fit for you. I'm sorry.
I'm outraged. This stunt makes me want to take action to help others who might be discriminated against because of their age.
What'd you think about that? I was shocked that the number of folks who seemed compliant in the beginning. Were you? I mean, for some folks, they still did business with this truck, even though it was clear. Towards the end, folks started getting outraged, but for a good half of them, it was like, no, I'm down under 40. I'm safe. We were actually surprised. This was a video experiment, and we thought we'd see a lot more outrage than we did. This was in the early stages of us trying to figure out how we wanted to position our disrupt aging messages. And this told us that we had to be a lot more hard-hitting because, frankly, a lot of people don't see ageism. Had those been all people of color, we hope. Not saying that's a perfect scenario either. But would the outrage have been a little bit more expressed? There are a lot of things that are limiting and sort of relegate aging in our society. The very notion of nursing homes and how we sort of corral people who are older, age segregation in housing, and sometimes it's voluntary. Sometimes people elect to live in communities that are for older folks. We call it big, beige, and boring products at AARP. And they are products that may be geared to older adults, canes and wheelchairs and the like, that are very necessary, but aren't designed with the same kind of flair as products for younger people. Mandatory retirement. I actually thought, and I work at AARP, I actually thought that mandatory retirement was something of earlier generations. I have a friend who works at Northrop Grumman. Probably shouldn't say the name, but she's 60, and she was talking about when she retires at 62. And I said, well, why would you think about retiring at 62? What's magical about 62? You're healthy. You enjoy this job. She actually has a great job, an executive job. She said, no, we have mandatory retirement at 62. So there's still many industries that require, and I think 62 is a fairly young age, that require folks to retire early. So we're trying to focus on these outdated beliefs about aging and create some new opportunities. One of the outdated beliefs is that aging is only about decline. Aging can be about growth. That aging presents only challenges. Aging creates new opportunities. Trying to think that we were having a conversation last night, and there are lots of examples of artists, novelists, painters who really didn't get started until they were over the age of 50. Older people are burdens. Well, older people are, as I showed with the dollar bill, older people are contributors. More and more older adults are working longer and contributing to the society. And even when they stop working, they are real linchpins of their families because they provide daycare, both for younger generations and older generations, children and elderly spouses. Right now, we're fighting aging. Nobody wants to get older. Nobody wants to talk about aging. We want to fight ageism. We want to fight the notion that at age 60 or 70, people basically are put out to pasture. And we're talking to you as a spectrum. We want young adults as well as old adults. We actually think some of the folks who perpetuate these notions are really more older adults and how we think about how we're aging. How many of you have a Fitbit in the room? Oh, wow. You should turn around. There are a lot of people who have a Fitbit. I have a Fitbit on. And my Fitbit is actually timed. It used to be annoying, but now I'm used to it. It buzzes every hour if I don't move 250 steps. And it buzzes a lot. And that's it, but it has, I've had this version, because I've lost about 4, for about a month. And I'm amazed at how little I move sometimes. And my whole notion of exercise was not move through the day, and then a couple of times a week, I'd kill myself in the gym for an hour. And research is showing that if you don't move hourly, well, I heard somebody describe it as sitting is the new smoking. Meaning that, fortunately, the statistics around smoking have reduced, but we are, even if we're not obese, we are a very, very sedentary society. And the benefits of moving a little bit an hour, 250 steps are not that much. I actually sometimes do it if I have this time to do from 9 to 10 o'clock. It's just, in the evening, it's just arbitrary. That's 14 hours a day. I'm supposed to move at least 250 steps. And I'm a pretty anal person. And this buzzes at 10 of the hour if I haven't moved at least 250 steps. So it can be 9:30 at night or 9:50 at night or 10:50 because it stops at 11. And I'm marching around my bedroom trying to get in those 10:50 steps. You know, so it's very, I am a pretty anal person. But it caused me to read more about the impact of exercise and eating and just things that, a lot of the things about how we age are not within our control, but a lot we can impact. And I'm not blaming the victim here. I'm not blaming people who get sick. But I was with my CEO yesterday. I hope I can remember this statistic. So of your health status, 60% are things that you can control. Health, exercise, eating, sleeping, which I'm terrible at, and I didn't realize the connection between sleep and health. 20% is access to quality care, and 20% is dictated by your family DNA, your familial traits. That was actually the reverse of what I thought it was. I thought 80% was related to family and just sort of destiny, and a very small part could you control. So I'm going to say that again. 60% are controllable factors. 20% are access to quality care. And for poor people, that's not a minor percentage. We know that a lot of people in this country don't have access to good quality care. And 20% is your family DNA. So what I'm suggesting when we talk about the new opportunities, it really is premised on the notion that we will take a vested interest in how we're aging, that it all doesn't happen magically, that it will be about decline unless we try to focus on some of what's controllable. And stress, not all stress is controllable, but some of the stress that we endure, habits like eating, exercise, sleeping, those are all kinds of things that as we age, we need to focus on much, much more. So we're asking you to join us to challenge outdated beliefs and spark new solutions so more people can choose how they live and age. I have somewhat of an issue with this, again, because I work in the multicultural space, and I really argued with the folks. They said I didn't have my microphone on, so I'm going to move around a little bit because I think now that it's on, you can hear me a little bit better. But I want to be careful that AARP, as an organization, that we recognize that that word choose is a loaded word. Because I know a lot of people, I grew up in North Philadelphia, a lot of my family still lives in North Philadelphia. I'm considered, one of the family members that made it. All of you in this room likely are one of the family members that made it. No matter what problems you're dealing with, if you were able to get here this evening on your own accord, in your car or in a bus, and can afford to spend an hour here listening to a speaker, you have made it on some levels. I'm not ignoring your problems, but there are people who don't have the choices that we have. So part of my job at AARP, when I become the voice of folks in the multicultural space, and they're not all multicultural. Multicultural, as I said, it doesn't all mean race and ethnicity. Multicultural is a very loaded word, but when I show this slide, part of me chafes at the notion that everyone can choose how they live in age, because I don't think that's exactly right. Because I don't think the folks that I saw in the rehab facilities that really at 64, 65, and they're going to live another 20 years, sick and disabled. I don't believe they chose to live and age that way. But I do think that if we challenge the notion, I do know for everyone in a rehab facility, I know people who are healthy but limited themselves in their choices because of their feelings about age. And if I'm 65, I can't do that. Or Lisa had an event the other day, and the Sex Over 50 event, which we all needed to be at, I guess. And there was two women who talked about wanting to skydive. And they met each other there, and now they're going to figure out a way to skydive. Now, that wouldn't be my choice. I'm paranoid about breaking a bone at this point. But I applaud that that what limited them about skydiving wasn't the fact that they were 72 or 69. They just wanted to do it with someone. So it's really their shyness. It had nothing to do with their age. That's disrupting the aging conversation. They're healthy. They were able to do it. They had the means to do it. Sometimes it's just my ex-mother-in-law is healthy, can walk, just doesn't want to. Just won't walk to the corner and back. So every time I see her getting older and older. Has nothing to do with her age. It has to do with her outlook. That's what I want to is the challenge. That's what's outdated. That she is choosing to do. But people in nursing homes, people who don't have the means that we have in this room, we just need to be sensitive that there's not always choice. So we're issuing, and I'm going to wrap up soon, and I'd love to hear some reactions to what I'm talking about. We're issuing a call to action that there are dramatic shifts in aging require a new social contract. The traditional models of work, retirement, education, even marriage are being challenged as more people live longer and hopefully healthier lives. I mentioned that I spent time with my CEO yesterday. She talks a lot about disrupt aging. She was the one who wrote the book, and she is a member of the Links. And I know there are a lot of Links in the room. That's an African American women's social service organization. She asked some of her friends, if you knew you were going to live to be 90 or 100, would you have married the same person? Rhetorical question. Rhetorical question. Rhetorical question. Okay, you guys are laughing a bit too much. But the whole notion of, I'm 62 years old. I just had a birthday in January. So for the first time in my life, I'm actively thinking about how much longer do I want to work. But I'm healthy. I feel fine. My kids are almost out of the house. I have great kids. They'd be appalled if they knew how much I talked about them. But I wonder, what's magical about 65 then? Maybe I want to do something different, but I don't know that I want to go home and sit in the house. I don't play golf. I don't play tennis. I do walk. So I agree that the whole notion of looking at these models of work, retirement, education, and marriage, we need to think about differently. At the same time, though, I do want to remind folks, and we are a nonpartisan organization, but AARP is very actively involved in the fight to ensure that Medicare, Medicaid, and Social Security are kept intact, not only intact, but strengthened, because a lot of people in this country need those supports. So while there are dramatic shifts in aging, we are not talking about dismantling safety nets. There's also an opportunity for leaders to create a new vision for aging with new stories, new innovations, and new civic solutions. And those leaders are all here, and I'm particularly talking to the students in the room, no matter what age you are. You can be a part of this new opportunity to create new solutions. Not taking action will have a ripple effect on our longevity, our economy, and our public health. The intergenerational workforce, and this is one piece that is fascinating now. It can offer a strategic advantage if organizations have the right strategies and tools in place. We need to prepare our workplace for people my age to work and report to people younger. How many people in the room report to a younger person? Someone significantly younger than you? Not a lot yet. That's going to change, folks. That's going to change. And it will require a mind shift in terms of what we consider experience, what we consider expertise. Again, ageism goes both ways. I've heard some of my friends say some outrageous things about younger people. You know, that they don't feel like I could ever report, they don't know enough, who does she think she is? Where I'm reading the resume, it's like, this is a badass person. They've got a lot going on. But because they're 35 and you're 52, or because they're 29, in DC, we are built on 28, 29-year-olds who just are incredibly talented and dynamic folks. But there's a real tug of war going on because older folks aren't recognizing the value and the strength of younger folks. So this intergenerational workplace, a lot of people feel, and we now have the rise of a 5-generation workforce that's going to coincide with large shifts around working. The notion that I'm 62 and might want to work till I'm 70, that in some ways is disruptive because our economy right now is based on me moving out of the way soon. You know how many people would like my SVP job at AARP? A lot. And I actually think about that. You know, what my legacy is, and the whole notion of moving aside. But those are very individual, personal conversations. But our workforce and our work economy is not ready to help people manage those decisions yet. The desire for flexibility and the new ways of working cut across generations. I gave back a week of vacation last year. I think I get 5 because I've worked at AARP for. My kids are scandalized. The whole notion of giving back, they think, I think I dropped a couple of steps in their eyes when we're just having breakfast one day. I took them out to breakfast and I just casually mentioned it. The conversation stopped. They thought that was supremely unhealthy and something that they would never, ever do. My daughter, who's a little anal, she sets a calendar at the beginning of the year to make sure she takes every one of her days. Well, I'm just stumble along and, I finally get an email from HR that says you haven't used X number of days. Do you want to give it back into the pool of folks who can use it? But that's a shift. I've noticed that millennials value their free time and their work-life balance much different than I do. That's actually pretty healthy. I didn't tell my daughter that when she was preaching to me that morning because she preaches to me about so many things. But this is an entire shift, mentorship and new approaches to acquiring new skills will be needed to enable people to navigate the workforce in the future. And that's mainly young people teaching older people. We would not have been able to have this presentation had there not been someone who could help me navigate how to switch from the video to the... Now, I'm not buying into that stereotype, because that's another thing, because I'm on Twitter, I'm on Instagram, you know, I'm figuring out Snapchat, so don't hand me that stuff, young people. You know, and Facebook is old school. We're all on Facebook. So so don't buy into stereotypes, but there are just some things like this, or like following a Google map as I'm walking. I can follow a Google map in the car, but something about the arrows, I always go the wrong direction. Always. I always stop a younger person to ask me to figure out, because, you know, first of all, I'm proud that I even know that there's a Google map thing. So, I hope I've re-emphasized that this is an intergenerational conversation, and older people are just as guilty of ageism as some of our younger counterparts. So finally, how to get involved. I really want you guys to think about next steps, and I never like to give a presentation where there aren't some action steps. Build awareness. Just have your own conversations. Talk to your own family members about how you perceive age and how they're aging. And think about how you want to age. Watching my mother over an 8-year period get progressively sicker and sicker and sicker. That's why I have a Fitbit, because I think I have my mom's genes. I think I can live to be mid-90s. I loved her dearly, so much. I don't want my last years to be like her last years. I've already told my kids, I don't want you guys to have to take care of me. They're all raising their hands because it was a wonderful experience, because we took care of her together. So my kids know what caregiving is all about. They helped me a year later after my mother died. My brother got seriously ill. We did that as a family, but I don't want to count on that. And I actually do not want to live with them. I got long-term care insurance because I know how expensive it is. And I have a pretty good job. I could not afford a 24-hour CNA for my mother. It's $21 an hour in DC. It can be $25. A lot of people go under the table. Gail's sister so-and-so, niece who needs a job and is between, can you come in and stay at the house while I'm at work? There's a whole underground economy around caregiving because people can't afford. CNAs are worth it, but it's hard to afford. So building that awareness, planning for as you get older, understanding what the trade-offs and what the needs are. We asked our members, and there are a lot of AARP folks in the room, host a Disrupt Aging Salon. We'll ship you a copy out of the book. Just talk about it. Talk about ageism. Talk about the changes. Talk about the fact that the person who's going to live to be 150 is alive today, and what does that matter? Talk about what if Aunt Sue lives to be 120. Most people think I only have to figure this out till they're 85, 90. That's not true. You need to be prepared. Join a Design Challenge is really about a lot of the mechanisms and things we have in place in our home are not really geared to an aging society. Yeah, we all know about ramps and we all know about chair lifts, but there are a lot of other aspects to your home and our general workspace that need to be adapted. And then this is a university sponsoring a research project around aging, around stereotypes, around... I wonder if you did that food truck experiment here, what would you find? Is Western Michigan University a much different place, much more enlightened? Would you find more of that, less of that? And if so, what would that suggest that you would need to do? So that's my message, that when you talk about diversity, when you talk about stereotypes, when you talk about isms, racism is important. Understanding the challenges that women face more and more, because I have a lot of friends who have, unfortunately, children who are autistic, and that's sort of an unseen bias that we have about people who have disabilities, and their families deal with a tremendous amount of stress that often is greeted by a very unsympathetic public. Those are all issues of diversity that we need to keep in mind, but ageism is also real, and we all are guilty of it, even if you say, I'm having a senior moment. At 55, really? You're just forgetful, you know, and that happens true as you age. I'm going to talk tomorrow about just the whole notion in the African American community of dementias and just brain health and how scary that is. And for that chart that shows how many people are going to be over the age of 65, the chart that shows how many of those will have dementia or Alzheimer's also grows exponentially. And it's a very huge problem in African American and Hispanic communities. And that's a whole different reality. But thank you for coming out this afternoon. I hope I've given you something to think about in terms of your life and how the kind of conversations you'll have in your own families and communities before you call someone old or over the hill or buy that birthday card that says, now you're 50, you know, welcome to the over the hill gang. I wish somebody would give, no, that's it. But I just wanted to be thought-provoking and bring some awareness. So I'm happy to engage conversation or answer any questions. I'm just interested in hearing what your thoughts are about this topic, particularly from some of the younger people in the room, not to ignore our older guests as well. But we'll open it up now. Any comments or any questions? Mm-hmm.
The last time I sat in our conference, and I realized that I had parameters on my life. I'm 70. My mother is 90. My grandmother lived to be 111.
Oh, wow.
Now I'm listening to the things that we should start to do now. Would it be, should we change our mindset?
Mm-hmm.
Should we change our intake of food and vitamins? And also should we get into our health plan, more positive people and or things? Can you tell me, should it be a unification of all of those things?
I think it is a unification of all of those things. She talked about AARP had an initiative called Life Reimagined. We were really encouraging people to, again, it's along the same themes that nothing magical happens at 70, that your dreams stop, that you really should have plans for every portion of your life. And that's what we see happening, that people, the old notion of retirement where people just stop and start playing golf or volunteer, that they don't bear out anymore. But she was asking, what should you do? And I think it is a combination of things. It is making sure that you move every day. It is preventive medicine so that you have the tests that you are required. Men in the room, you really need to have your physical exams and monitor symptoms. What we've found, and we have had an increased focus on, is social isolation. More and more studies show that the older you get, your connections to people, it doesn't have to be, I worry about this Facebook generation where you have, you need like 2,000 people in your group. Although I will tell you, my brother, and I always get a little personal because I just think it makes it more real. He got terribly ill. He is in Milwaukee, and he had 5,000 people in his Facebook family. And we used to argue about that. It's like, you don't even know half these people. You don't know 50. Well, I posted, when he first went in the hospital, a note about him going into the hospital. And I was stressed. It was Christmas. He had come to visit me. He basically fell into a coma while driving on I-95. It was a very stressful time. I was absolutely amazed at the outpouring of these strangers on Facebook. They got me through. 800, 900 people a day checking in on him. People sending me messages about people wanting to start, and we didn't start a GoFundMe campaign because it wasn't about the money, but I don't say that, these were living, breathing people who cared about my brother, who sent me prayer cards, and they were of all denominations, of all races, all ages. I was amazed. So I don't scoff at the connection. And he lives alone, and he's not married, and he doesn't have kids. So I've always been worried about him. Not so much anymore. He doesn't see them on a daily basis. 2 of them drove from Milwaukee to Maryland to check up on him. Basic strangers. He used to be a journalist. I can't say too much because I said it in one speech and they actually figured out who he was. And then they came up to me later, it's like, is your brother blah, 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 blah. And I said, okay, but you can't tell him. Sure enough, I got a call that night. Did you talk to him? So I don't trust any of you guys anymore. You can probably still, I'm not, shouldn't have said the city. But anyway, and they had checked in with me and, you know, they demanded to know details. They were like, what? And I was saying, you know, look, I'm not going to put on Facebook what his medical issues. So we worked out what I could say. But it was a living, breathing community. And that is a part of his coping group. Even though he doesn't know all of them personally, they helped us get through it. So the notion of social support, we find that people who are isolated, who don't reach out and don't have connections on a weekly basis, tend to get sicker and die sooner. That's often also for the caregiver, because, you know, I think this is anecdotal. And there's so many university researchers in the room. I want to preface this, but when I was a caregiver, I was often told, you know, caregivers die before the person you're giving care for. I don't know if that's based in science, but I can see how it's okay, it is. I'm in a university. You said it is. I believe it. But, you know, I'm a church goer. I couldn't get out to church because I couldn't afford to pay someone on Sundays to also watch my mom. I paid someone to stay with my mom till 7. So I worked in downtown DC, so I had to race home. I couldn't stop and have drinks. I couldn't stop and have dinner. So I understand that. I felt so alone, and before I started talking about it, which I did towards the end, I felt very isolated and very depressed. So social isolation makes a difference also. So having some friends, it doesn't have to be 5,000 people on Facebook, but having some social outlets, watching what you eat. Obesity obviously is a huge problem in this country that only gets worse as you get older. I have a lot of friends who are on canes because they weigh so much their body can't carry their weight. I make no judgments. You know, we go out, I have a traveling group, we travel and on a cane, and if you want your waffles for breakfast, everybody's an adult, you have your waffles for breakfast. You just recognize that you're making a choice. So all of the things that you talked about, I think, make a difference. And as we age, because again, while people of color have greater morbidity, meaning they die sooner, even people of color are living longer, but they're living sicker. And the things that you rattled off are the things that can make a difference. I want to live long, but I want to be healthy and be able to take care of myself as long as I can. So thanks for pointing that out. Any other comments or thoughts about aging or how you age? I want to hear from a young person in terms of, did anything we talk about today change your notion of what it means to be old? And I'm old school. I will actually call on somebody. So I'm going to call on you. You just had your hands like this? Yes, you. Stand up and tell us. Have your impressions changed at all? Loud? Oh my.
I don't think it really changed a lot, but I do see that there needs to be like change in the way that some people do it.
That's great. Her grandmother's doing, even I don't do Zumba. I'm not coordinated enough. Yes.
There's an issue that concerns me, and that is that there are a lot of researchers in the aging arena doing interesting projects that the general public never even gets to hear about, let alone to see how they're developed. It's like the research supports the PhD and not general information. Is there anything that you know about that's happening that might share more of that kind of research?
I think that's an interesting comment. At AARP, we do a lot of research, but mainly around public policy issues because we are so involved in advocacy fights. I would turn that question to some of our true researchers in the room. I think your point is, how can we make research knowledge more readily available to the general public so that they can use it on a day-to-day basis? And I think that's a challenge. I sometimes worry that we only hear snippets, like food. You know, 1 year coffee is healthy, the next year you're not supposed to eat it, drink it. Like the notion about moving every 250 steps an hour, where it used to be just do an hour of cardio a week. So you can get a little jaded, and it's hard to keep up with what should be, what you should apply to yourself. But do any of the researchers in the room have some recommendations or suggestions?
Some of the research that they're now making public, so you're right, as opposed to supporting the dissertation and just putting it in journals, that now that researchers are allowed, at the university supports it, to give funding that your work can be made so someone can get it off the internet,
right,
and they don't have to get it through the library. And that's a way that we can make it more available to the public. That's
right,
one way. The other thing is that as a researcher, you make it a point yourself to disseminate your work within
right,
the community, as
right,
opposed to just for finishing a doctorate.
Right. And I would suggest that just like we talked about the social contract for aging being different, I know there are a lot of students in the room at various levels. I think your contract about what it means to be a student, and particularly at the doctoral level, I think that needs to change so that it is more community-based and community-focused, so that we, the research is research that people can use in their daily lives. So that's a challenge I put out to the researchers in the room. There's a hand back there. Are we okay for time? Okay. Somebody wave when we need to wrap up. One more question. Okay. Nice and loud.
I'm a counseling psychology student, and I have noticed, like, in our department, a lot of the time people say that they don't want to work with the older population because it's like prepping for an end of life.
Oh. Mm-hmm. Mm-hmm.
Psychology, therapy. So I think that's like a big bias that I notice a lot, like, in our programs, just with the students.
Right. Now, end of life is tough. And it's tough for family members. It was tough for me because, one, you can't predict it necessarily, and in some ways it seems counterproductive to always be thinking about the end of life when you're dealing with someone who is alive. You want them to be alive and with you now. Again, I'll get a little personal. My mother could have used hospice services a lot sooner than we finally made the decision to do that. And, I have some regrets, and that's one. I thought I was a good daughter, and I did the best that I could. I didn't quite understand, and I work for ARP, I didn't quite understand hospice, but I didn't stop to educate myself about hospice. And I think that's true in a lot of communities of color, that we don't use end-of-life services a lot of times because, especially in religious communities, like, you're not going to claim that. Have you ever heard that? I'm not going to claim it. You don't want to claim that mom might be dead in 2 months, because it sounds like you're planning for her to be dead in 2 months. So I think the whole notion of end of life. But what I do want to say is end of life care. You don't need to start talking to somebody about end of life care because they're 70, because they could be, again, if you're able to practice good health. Remember, 60% are things that are within your control, 20% DNA, 20% access to care. So, people can live longer. And end of life doesn't mean you have to have that conversation when somebody's at 65. You do have to be prepared. And I'll end with this. And again, when we're talking about diversity and multicultural, but this is across the board. People aren't prepared to talk about end of life. How many people have a living will? Not quite half the room. How many people have a will? A little bit more. And I'll end with my last example. So after my mother died, my brother had this catastrophic episode. He was actually in a coma on life support for about 5 weeks in the hospital. And like everybody, I'm Googling, trying to figure out what's going on. Also, if I'm honest with myself, very afraid that I was facing another long-term caregiving situation. And I kept reading that you only keep people on a breathing machine for about 4 or 5 weeks, because after that, there can be irreparable harm, and then you're just looking at a long-term thing. So I started, because I'm type A, I started arguing with the doctor. I don't think my brother would want, what is the plan here? How much longer? Every day they try to wean him off, and he'd go into, you know, respiratory distress, so they put him back on. This went on for 2 weeks, and I finally said on a Thursday, I want to talk to the doctor tomorrow, Friday, because I don't think my brother would want to live this way. And so I went in on Friday, ran to find that doctor. Of course, he was nowhere to be found. I think it was ducking me. And, you know, if you ever had somebody hospitalized, weekend, the whole shift is over. So I knew, okay, I'll come Monday, and we're going to have this conversation, because I don't think this is not what my brother would have wanted. Now, granted, he had nothing. He had no will. He had no living will. He had documented nothing. He lived in one place. I lived in another. So I come really head of steam on Monday, you know, got to the nurse's station, said, you page that doctor, I want to talk to him now. Walked into my brother's room, and he sat up and said hello. And I collapsed in tears. I must have cried for about 15 minutes. One out of relief, but one out of what I almost did. So, and then we've since talked, and he's like, if there's a wire, if there's a cord, if there's a plug, you have me plugged up to it. You know, I mean, it's like, no matter what it takes. My mother was like that too. Whatever it takes, you exhaust every single thing. I never told him that story, so the folks who are trying to figure out who he is, do not tell him that story. But he made it clear, no, I want you to do whatever it takes. And my mother was the same way. I don't want that. So I was projecting onto him for me. But that will stay with me for the rest of my life. I walked in that room, and he sat up and said hello. And he couldn't understand. It's like this. Well, he didn't know. You know, I had taken video and could show him the whole thing. But of course, he didn't realize he had been out for 6 weeks. So he's like, what are you doing? I mean, and he really, so anyway, so my last point will be, yes, we're fighting ageism. Yes, it doesn't mean that you have to age a certain way, and it doesn't mean a sure death at 60 or 65. You don't have to be sick. You don't have to age poorly. All of this vitalization is possible, but you do have to be prepared. So even the youngest person in this room, you need to have a sense of what you want to happen to you if you do become disabled, because unfortunately we never know. Thank you very much. I really appreciate it being here.